What's up, guys? Welcome to Building the Burbs. My name is Howard,
I'm Keegan.
and we have a very, very, very special guest today, Marcus Azeh with Lavni. And he's gonna kind of just be talking about the journey. Marcus, tell us a little bit about Lavni and what it does, and we can start it.
Yeah, thank you, and appreciate you guys inviting me. Yeah,
Yeah.
Lavni is a mental health platform. We help providers, we help therapists with the tools they need to be able to see Medicaid clients. So if you have Medicaid, Medicare, and you are looking for a therapist, Lavni is the place to find one.
Go a
Yeah.
little bit on that. What was your, and I know we were talking a little bit about this right before, but what was your personal motivation and even your co-founder?
Yeah, absolutely. So, finding care is not straightforward. It's not
Yeah.
always easy. Um, I remember it was 2022. Before I met my co-founder, I just got some news. My son was diagnosed with autism. My boy, he's 6 now. And just navigating that was really hard. Being a parent for the first time and trying to figure out, how all of that works.
Yeah.
Um, and even though we had, good insurance, say private insurance, it was still hard to find care, especially for my son. His secondary insurance was Medicaid.
Hmm.
It was just really impossible. Um, and I met my co founder. She's a licensed clinician. She's been doing this for a decade. And primarily, the demographic that she sees and helps is Medicaid, Medicare. So she said something that was weird. I think it was she said, you're privileged, right?
Mm.
Mm.
What? And well, what she meant was, it's if you have private insurance, it's easy for you to get online, find a provider, book an
Yeah.
appointment. You have Medicaid, your chances are way slim,
Yeah.
right? So
100%.
that's really what she was talking about, and I'm like, well, tell me more.
Mm-hmm.
And then that became a 3 hour conversation, and I'm like, well, I don't know. And then more and more conversations, and like, well, let's start with one thing, right? Why is it so hard for providers to see people who really really need help the
Mm.
most, if you think about it? Um, and then we started, and the rest is history. Yeah.
Cool. S-
So looking demographically, what's been, and I know you've been running for a few,
Mm.
what has been, if you were to split it up, what market or I guess what kind of patients have you guys started to focus on and why?
Yeah, we specifically focused on clients who have Medicaid. So if you use Medicaid as your insurance, that's primarily who we see. The reason for that is they're super underserved, right? There's
Yeah.
just most providers do not. They just and the main reason, and I'll talk about it a little bit, is
Mm-hmm.
just it's really hard to see Medicaid clients.
For sure.
Yeah.
Medicaid has a huge, complex credentialing process that could take up to 9 months. Who wants to wait nine
Yeah.
months to
Yeah.
start seeing clients and start making money? They don't pay the most, right? And the billing is complex. Most providers end up losing money, not getting paid.
Yeah.
Um, and then they also have a lot of documentation requirements.
Mm-hmm.
It's a lot, like a 21-page assessment. That takes 3 hours out of a provider's day. Next time they could be making money, seeing clients,
Yeah.
and it's just so easy to see a client that's paying out of pocket
Yeah.
or
Yeah.
has private insurance.
For sure.
So that becomes the choice. So they make that choice, unfortunately, for when it has Medicaid or Medicare. Um, but just because the market kind of pushes them to make that choice. And that's where we stepped in. And we wanted to understand what was the problem. Of course, you have three stakeholders. You have the clients who need
For sure.
help, you have the therapists, you have the providers, and then you have Medicaid, the
Mm-hmm.
Yeah.
payer. So we wanted to understand what was the big deal with Medicaid, why you doing
Yeah.
this. And you get defrauded. There's a lot of fraud,
Mm.
believe it or not, that happens. And And I guess one of the ways they try to prevent it is just to make the process extremely hard.
Yeah.
Um, Unfortunately, and then we first thing we built was a one-click audit system that made it really easy for them to audit our records and make sure that this transaction is valid, right? So that just kind of opened up the door, I would say,
Yeah.
for them to be able to trust the system and be able to and then now we're that vehicle that we can get clinicians credentialed way faster than 9 months. 3 weeks they're ready to see clients.
Yeah.
Um and and yeah, so that's specifically who we're solving for. It's 80 million plus people in Medicaid alone in the US, and about, I would say, last time I checked, about 29 million of that 80, have some kind of diagnosis. So these are people that actually need help today.
Yeah. Yeah.
Just can't find it.
So what was the validation process like? Like, kind of going through it, it sounds like a no-brainer, you know what I'm saying? But like, how did you go about like saying, okay, I know that people want this.
Yeah, a lot of conversation, a lot of conversation, and really helped that we had someone that's been doing it for years, right? Also, another member of my team, Crystal Bush, she was the former policy writer for Medicaid, Medicare for the Carolinas.
Oh,
So
okay.
a lot of stakeholders that understand this problem very deeply,
Yeah.
um, way more than I do. Coming from the tech world with a tech background. Um, but we talked to a lot of people. We wanted to understand. We started with the providers.
Okay.
What is the process? What does your day to day look like? And just what is that thing, right, that is keeping you from seeing Medicaid clients? And we spoke to, some of providers, in rural communities that were actually seeing Medicaid clients. What is that process like for you? What is, how could we make it better? So just really understanding what, know your customer,
Hmm.
understanding what the pain points were, and then of course, huge demand.
Yeah.
And we saw that by we did really interesting things like looking at keywords that were trending on Google. One of the keywords were you know, trying to find a therapist that accepts Medicaid.
Yeah.
And you know, um interviews with a lot of people that community centers, nonprofits that were actively seen, this demographic and understanding all those points. Of course, talking to MCOs, managed care organizations. So they manage the Medicaid program on behalf of Medicaid,
Okay.
and also understanding what are the pain points, what were they trying to achieve. So a lot of talking, a lot of testing, building a prototype and testing, iterating really quickly, got us to really realize this is a big problem, and come up with a good enough solution to go to market with.
Gotcha.
So I know you talked about a couple of the steps Lavni's been taking to, maneuver through Medicaid and whole jumble that it is.
Mm.
But if you were to give us like a TLDR or short version of how do you guys actually do it and what are some steps you're taking? I know you mentioned doing those Google searches, the auditing,
Mhm.
but what are some other things that really helps you make it easier for Lavni and these customers coming in slash patients?
Right. So once we kind of solved the fraud thing for Medicaid, it became really easy for us to, as a clinic, because we are a clinic,
Hmm.
be able to onboard new clinicians.
Yeah.
So in order to see Medicaid clients, you have to get, I'll call it approval.
Hmm.
It's really called credentialing. So you get that provider credentialed with Medicaid, the payer, and then once they're authorized, they can start seeing, those clients. So that's what we do.
Yeah.
And then also understanding the billing process,
Yeah.
right? How do you bill, manage the claims? Um, which it's a complex process. You have to do it quickly because Medicaid doesn't pay as fast as
Yeah.
everybody else. So we automated that process. It was very important that we automated. Very important that we build as soon as the session was done. So we're able to build that application, be able to bill automatically. And then the telehealth side of things, right? Make sure it's HIPAA compliant, it's
Mm-hmm.
safe, it's secured, have that all in one place. And then the documentation, which
Mm.
is a big part of it, being able to document. We have our own proprietary models, AI models that are able to generate the session notes to make sure that you have that continuity of care, the assessment.
Okay.
I was telling you about the 21-page report. We knock that out in 20 minutes or less. So it just gives the provider more time to see more clients, earn more money, help more people.
Yeah.
So that's really, you have all of those things all working in one, powered by the platform, to make sure that provider has all the tools they need to pour into the client.
Yeah.
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 Yeah. And in the beginning, when you were like talking to these providers and stuff, were there any like objections or any challenges like that was
Yeah.
kind of
Yeah,
holding?
they did not believe they get paid. Yeah, no, for sure. A lot of providers, Medicaid, no, no thank you. We heard a lot of that.
Mm-hmm.
Medicaid does not pay; they take forever. So one of the things that we did to really overcome that objection was to float clinicians. Like, we'll
Mm-hmm.
pay you weekly.
Yeah.
We'll pay you. Don't worry about it.
Yeah.
We'll take care of Medicaid. So that became, and then they're like, well, what are your documentation requirements, right? Because they know
Yeah.
they've tried
Yeah.
this, and we, very slowly. And when you bring AI into
Yeah.
healthcare, it's like, oh, we want to
Yeah.
know this. You're
Yeah.
not, baking in Chat GPT on the back end. Like,
Yeah.
it's like, build our own models. This is how it works. This is how we validated it. As a matter of fact, uh, the early providers we had on the platform, because when you build models, you have to build this feedback loop
Yeah.
to be
Mhm.
able to improve upon it. They helped a lot with that,
Mm.
just making sure that
That's awesome.
everything was clinically sound. Of course, we baked in the DSM-5, but that's not always enough. So that really, really helped, and it was collaborative. They wanted to see that change, so they were happy to be a part of it. But yeah, it was it was like, why don't you just do private insurance? Why don't you
Yeah.
just do this? It's like, the client's gonna show. That's another thing, right? Because people would get nervous right before their session, like, I don't know, I'm not gonna show, and that just waste providers time. So we
Yeah.
had a solve for that, right?
Mm.
Be able to communicate, not spamming people, but just, hey, you gotta show up today, what's going on, so we know. We have this probability score that we track for each provider, the probability of that session happening, right, based on all of the interactions we had with clients before that session, and their previous sessions and stuff like that. Um, so when it's high, we know it's
Yeah.
green. So we have a very, very low no show rate, which is fantastic. Because on
Awesome.
average, um, lifetime sessions have about 14 lifetime sessions with a client,
Mm-hmm.
and that's really high because industry average is just about 5. It's
Oh,
ridiculous. So
yeah.
yeah, but lots and lots of innovation, and just talking to people that really cared a lot about solving that problem helped. Yeah.
So when you're looking at scouting these providers, where do you go find them as Lavni? And if they want to reach out to you, what's the best way for them to do?
That's a good question. So we have grown by word of mouth only since we started. We have 153 clinicians right now on the
Mm-hmm.
platform, and it's all been referral based. We
Wow.
Yeah.
get a clinician, they come into the platform, they see how easy it is to run their practice,
Mhm.
and because it's a lot of burnout. That's
For
also
sure.
one
Yeah.
thing. And they like, I just have to see my clients. I can pour into them,
Yeah.
and we do a lot of analytics so they can see how the client is progressing over those 14 sessions, right? Decrease of symptoms. So you really feel like you're helping someone.
Mm-hmm.
Yeah.
It's important. So it's been referrals, but if a provider wants to join, just on our website, mylavni.com,
Okay.
um, and then I'll go to the therapist tab. You can apply there, and definitely. We still do. My co-founder still does the first initial interview, so Laura will definitely reach out. Um, but one of the things that we're thinking about now, as we think about growth, is also to think about other growth channels like LinkedIn, and
Sure.
also putting out content so people know we exist, because
Mm-hmm.
that's one of the things, right? People
Yeah.
really don't know that a solution like this exists. And it's funny because I'll tell you this,
Mhm.
on the client side, uh we onboard some clients, right?
Mm-hmm.
They call us and like, is this for real? Do you guys really take my insurance? I'm like, yeah, like,
Yeah.
Yeah.
but it's just that disappointment going to different platforms and no one
Yeah.
will see your insurance. So
Yeah.
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 And so with Lavni being so like mission driven,
Mm.
like how are you able to balance like the business side of things? I know sometimes you have to kind of balance it. Like how do you balance that?
Yeah. High conviction,
Mm.
Mm.
right? Very, very high conviction that this is a problem worth solving,
Yeah.
right? I mean, if you think about the fundamentals of any marketplace, demand and supply,
For sure.
Mm.
right? Obviously, huge demand, tune
Yeah.
of
Yeah,
30
definitely.
million people, um, and then making supply work in a way that is valuable to supply, right? Make sure that a therapist actually makes a profit,
Yeah.
right? They're able to build a sustainable business for themselves on our platform is one of those things that we focus on. And um, I believe good business exists when you solving a problem that is important,
Definitely.
and is big enough. Of course, it has to be big, um, and that high conviction that this is it, and now is the right time with all the advance in technology. Like we have models that are doing all these great things to help therapists speed up their operation,
Yeah.
uh, just high conviction, and of course, validating every day, and as you see that growth, because we see the growth of demand, it just helps to validate, and more people are now finding care. Um, it's rewarding in a way,
Yeah.
right? To see
Yeah.
that you're actually solving a problem and people getting value out of it. I'm not sure if that answers the
Nah, it
question.
did. It did. It definitely did.
Okay, good.
Definitely.
So I'm kind of going back to what you were just talking about. Let's be honest, with the current economic state and where we're at,
Yeah.
consumers are just spread too thin. And, with Medicaid and Medicare still on that not so confident side,
Yeah.
Yeah.
where do you see the market going? What's your outlook on the next like a year, 5 years?
Mhm.
And how do you guys plan to stick out and keep getting help to the people that really need it?
That's a good question. Feel like everyone I talk to ask me that question. But
It's important. I
yeah, I
mean,
Yeah.
right
know.
Yeah.
now there's just with things going on how they are.
Yeah. So let me ask you this. Do you believe that Medicaid will exist 5 years from now, 6 years from now?
Definitely.
Okay.
Yeah,
Yeah.
I think so too. Um, Now, a lot of changes that has to come, right? So how we think about it, we at Labney internally like to do a lot of scenario based thinking.
for sure.
So we'll think about, when this happens, then what? Then
Hmm.
what? 10, 20 steps ahead. Um, and that's how we built the company, right? So remember, I was telling you about how do you decrease fraud, how do you
Yeah.
bring, value based care, right? Because when things are hard, there's not a lot of money. Um, Most organizations will, you have to clean out the fat,
Hmm.
Yeah.
right? Um, but then you also have to think about what is working and how do we do more of what is working. So how we see this playing out is, um, there is, of course, the state Medicaid programs are going to react to everything that is happening.
For
That
sure.
Yeah.
that reaction will be like, well, maybe credentialing is going to take 2 years now, and reimbursements are going to maybe be cut or delayed and stuff like that. You're going to see,
Yeah.
probability of that is high. Um, and that's going to make it really hard for a lot of existing businesses, small practices at rural communities to be able to compete in
Mm-hmm.
this
Yeah.
space, and that's unfortunate. But it's gonna be demand because more and more people um, need help, right? More and more people be on Medicaid, and we believe that Lavni will be that place where they can find help. And it will be that vehicle where we can onboard more clinicians that already exist and just cannot compete because they don't have the infrastructure
Mm-hmm.
to
Mhm.
do it. I don't know if I should use this example, but if you think about um, how Amazon just kind of,
I see what you're saying. I
right,
get the vision. Yeah.
exactly.
Yeah.
So building,
Yeah. I was just gonna ask, but
yeah,
then to your when you're saying you're doing scenario analysis, what's your if you can talk about it, what's your worst case?
yeah.
What's your best case?
So best case scenario, um, um, best case scenario is we become the default go-to platform for anyone that needs care that has Medicaid, Medicare.
Okay.
Mhm.
Right? We own this market. We take it as ours here first.
Yeah. For
Yeah.
sure.
Right?
For sure.
Um, um, and worst case scenario, I mean, really hard to predict, but say Medicaid gets canceled. Like,
Yeah.
no,
Yeah.
it's just
Yeah.
Medicaid, Medicare. We're not gonna do it anymore. It's just all gonna be private insurance. Now, we have a healthy 20% of our audience that are private paying clients, because what happens is onboard a clinician, they see value in giving them Medicaid clients. They see how quickly they can continue to
Yeah.
see
Right.
clients with less I guess burnout.
Mhm.
They now onboard the existing clients, and this will be commercial paying clients. Clients were paying, spending $0 to acquire or not. They just all come in because of referral.
Mm-hmm.
About
Yeah.
a fourth of user base is just plain referrals from therapists. We're not even talking about client to client referrals.
Okay.
So that is there. So we'll still be able to. You need to diversify when things you should diversify regardless. So
Definitely.
100%.
we have
Yeah.
that, but we've built a platform that does something that no one is able to do. Autonomously runs your practice. You don't need all
Yeah.
these people, and that's why most providers on our platform want to they kind of want a SaaS version of it.
Mm.
Yeah.
They asking us, how do I just use Lavni to run my practice? Um, not going to do that yet
Yeah.
because we're
Yeah.
focused.
Yeah.
But in the worst case scenario, there's always that.
Yeah.
And you can do scenario based thinking and run. You can see everything, but we've thought really hard about, if this happens, then what? This happens, then what? And we kind of have a game plan. But the most important thing is not to operate from fear. We don't do that.
Yeah.
Yeah.
Absolutely.
We have a high conviction, solving a big problem. It's growing in the market, and the data shows that yes, this is what is happening. So we're going to continue to do that. Continue to innovate. But if things go one way or the other, we know have the freedom to adjust.
Definitely. Definitely. And to kind of flip it, with everything that has happened, over the journey and stuff. If you were to look back, like when you first started, and you're with your co-founder, and y'all were just getting started, like what would you do differently, like during the process,
Um,
if there is anything?
I do. I don't have no regrets. Not
Mm-hmm.
Mm.
saying that in a like cocky.
Yeah.
Yeah.
I
Yeah.
did
Yeah.
everything
Yeah.
right. I feel like everything I did right or wrong made me who I am, and
Absolutely.
Lab Me as a company would not be here if we just didn't do those things.
Yeah.
Um, uh, but I would say that differently. Hmm, that's um.
If there is anything you do
Yeah,
differently,
Yeah.
I don't think so.
sometimes, yeah,
I think this is it's just it's divine. It was meant to happen this way.
yeah,
And just as we've grown, we've learned, we've iterated. It's
Mm-hmm.
just made us better and stronger. So you know, but if you say in hindsight, knowing what I know now, right? If I
yeah,
had that knowledge to
Yeah.
begin with, oh man, there's some moves I would have made to like
Yeah.
quantum leap,
Yeah,
but
for sure.
you never have that knowledge before
Exactly.
you start.
Yeah,
So
Exactly.
it's yeah.
But I guess too, what Howard was just asking,
Mhm.
if you were to name like 2 or 3 things that you learned throughout this whole journey that
Mhm.
really stood out to you and have added to you as a person, can be life skills, professional skills. What do you think they were?
Life is hard.
For sure, yeah.
It's
Yeah.
hard, it's filled with a lot of pain and suffering.
Hmm.
Not to say that in a really, bad negative way.
Yeah,
I
Yeah.
think it's important.
yeah.
Um, and I think one of the things that, because I was part of a startup before, but I
Mm-hmm.
wasn't the
Okay.
founder, and that is what it is. But man, I think I really underestimated. I think I didn't accurately assess how hard it was gonna be,
Mm.
Yeah.
right? Because I'm like, just gonna do this. Of this is a solution because I'm a problem solver. So I'm
Yeah.
like, but then the implementation, the time, Lavni has taught me
Mm-hmm.
a lot of patience, and just being able to see things very clearly,
Yeah.
right? Instead of there's a lot of wishful thinking and a lot of wishful like, well, it could, you know, you, your mind
Yeah.
will play games on you, but being able to, know, push back, sit and thinking like, well, what's the data
Yeah.
telling
Hmm.
me? It, just being a data scientist helps, I guess, because
Yeah.
I'm almost like, where's the data? Where's the
Yeah.
data
Yeah.
kind
Yeah.
of deal? Um, but yeah, that has taught me a lot of patience. It has also um, taught me like you have to go into this having the support
Yeah.
from your loved ones,
Hmm.
because your family pays the price,
Oh
right?
yeah.
You're working
Definitely.
Yeah.
hard and stuff. I
Definitely.
told you I have kids,
Yeah.
Yeah.
and stuff like that. Because every late night that I'm not reading a book to my kids,
Hmm.
I'm busy writing code. Could
Yeah.
be time, but I good thing was I have really good support, and we had a conversation about how this could look like, right?
Hmm.
Of course, it was way worse than
Yeah.
what we talked about, but they understood, right? They support him like doing something great, keep doing it. We have your back. So I mean, patience and just having that support is important.
Hmm.
Um, and knowing that it's gonna be hard. It's gonna be a lot harder than what you think it is. But you gotta be, conviction gives you everything because then it's like it's gonna work out.
Yeah.
It'll work out. It's just time and pain and all of that.
Yeah.
And it's worth it though. In
Yeah.
in, in the end, it's worth it. And I guess kind of to go off that, like,
Mhm.
um, what has been like the most rewarding
Mm-hmm.
out of this? Like, any like standout specific moments where you were like, yeah, like
Yeah.
this is definitely what I need.
Yeah, man. Besides, growing and, I guess now we're profitable, so yeah, that's a good thing.
Yeah.
But really the feedback get, because when we started, still now, I onboarded a lot of clients myself. So on the phone, we were talking,
Yeah.
and, out of the blue, I'll get a text message. Thank you so much. Like
Mm.
this, blah, 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 oh man, thank you so much. Or they'll leave a review on the platform. Um, or I will be that carrier pigeon, right? I
Yeah.
just wanted you to tell my therapist thank you because they really, and I'm like, wow, I really, just wrote code and not thinking that that would take people from
Yeah.
0 to 1, but
Mm-hmm.
it did for a lot of people.
Yeah.
And also to hear it from clinicians like, wow, I can't believe I made more money here than
Yeah.
X, Y, and Z. Like,
Yeah.
and I really like what I'm doing. I have time. I took a vacation, and that's the funniest thing. It's like every time, you know, um, because on our platform, therapists can go in there and just take time off. Every
Mhm.
time I see that me and my co-founder we get that someone's taking a vacation because we believe in taking care of yourself first, so
Oh yeah.
before you can
Absolutely.
help people. it just makes me smile. I'm like, wow, because before, therapists they just going, you gotta
Yeah.
pay the bills. It's just a lot and stuff like this. Um, but yeah, those two things, just that has been the most rewarding. To be
Mm-hmm.
honest. Yeah, no, for sure. It's been great. Just hearing that, it's like, man, I played a very small role in helping this person go from 0 to 1.
Yeah.
Making a huge impact though.
Yeah,
Huge impact.
yeah.
So I guess to that, what do you guys do to stay close to? Because it's two different bases,
Hmm.
clients and uh, the providers. So
Hmm.
how do you stay close to them? How do you build that relationship with each of them? Like, what are some things that Lavni does specifically to build that relationship, with their clients and then with their providers?
Communication.
Mm.
It's key for us, and so we have session feedbacks.
Yeah.
I feel like everybody has that, but after a certain amount of sessions, and I'm not going to say this out loud in case my competitors see here and try to copy me, we have that touch point,
Mm-hmm.
right?
Mm.
Where it's like,
Yeah.
how's everything going?
Yeah.
How are you feeling? Like, how was relationship? Whereas it's like this,
Yeah.
Um, and you think about it, well, you get to a certain amount of clients, it doesn't scale, but it's important at this
Oh yeah.
point, to have it. We'll figure out how to scale it.
100%.
Obviously, it's an optimization problem,
Mhm.
but really, really helps to connect to get that. Okay, this person, I saw them when I onboarded, or I heard from them when I onboarded,
Yeah.
and it's been X amount of sessions. Oh, they're still here,
Yeah.
kind of deal. And of course, we have newsletters and stuff like that. Our constant check-ins, and with the providers, man, we have a very tight relationship, right? We, as you think about it, they bring the most value
Oh, for
to
sure.
what we
Yeah.
provide. So constantly reaching out to them. We have touch points. We provide clinical director Krista was telling you about her, and she has a really good network loop where she's doing surveys, she's meeting with some of them one on one. She has weekly supervisions where therapists can jump in and stuff like that. And all of the therapists on our platform, they have our numbers as founders. Some
Yeah.
clients do too.
Yeah.
So it's that direct relationship.
Yeah.
This is a
Mm-hmm.
problem that I have, and
Yeah.
it could be anything, could be personal, need to take some time off to take care of a loved one.
Yeah.
Yeah.
So, of course, at scale, we'll figure out how to optimize it.
Mm-hmm.
But now it's really keeping that more. Hey, I know you. You know me. You can talk to me.
Yeah.
I can talk to you.
Yeah.
Kind of deal.
And I know we kind of talked about like the deep future
Yeah.
of Lavni, but I guess like the immediate future, like what's next?
So, of course, we're raising
Yeah.
our seed round, and really, 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 goal is to grow. Just so much demand, so many people that need help.
Mm-hmm.
We want to be able to grow our clinician base, and to grow the client base. We want to be able to expand to multiple states. We're in the Carolinas now.
Okay.
Um, we living in Georgia, growing that slowly. But we, Medicaid, Medicare is a state,
Yeah.
you have to conquer one state to the next one,
Mm-hmm.
to the next one, to
Yeah.
the next one. So that growth is important. That is it for us. That's what we're focused on. Um, Long term, I mean, we say this, and it was like such a big goal. Like, man, how are we gonna get there?
Yeah.
But 2030, our goal is to at least have impacted 10 million Medicaid, Medicare clients
Wow. Yeah.
that have gotten help
Yeah.
through our platform.
Yeah.
Yeah, we're on the way.
Yeah.
Yeah.
So I guess to that, you know, there is a mental health epidemic right now, and is only going to increase from here with
Yep.
how things are going.
Yep.
How does Lavani stand out in the market that's growing up so fast? There's so many competitors. There's all chasing a similar demographic, but I
Mhm.
know you guys stand out with Medicare and
Yeah.
Medicaid. But besides that, what are you guys doing differently, or how are you looking at the market differently than all of your other competitors?
Yeah, I think you have to be effective.
Mm,
You
yeah.
really have to think about, are you helping someone? I mean, it's easy to provide care.
Yeah, exactly.
That's
Yeah.
okay.
This is
I
effective
care
care.
what I do.
Yeah.
But you really have to be effective, and we're super data driven.
Yeah.
Remember I was telling you about the amount of times,
Yeah.
14 sessions, and we want to see, those symptoms decrease over
Yeah.
time, right? So we're constantly looking at data. Um, the clinicians, we're plotting all of these things for them to be able to see and seeing what is causing it. So, for
Yeah.
example, someone can start, and these numbers, they don't mean anything to you. That's fine. So someone can start at maybe um a level, let's just say at a 20, right?
Mm.
Let's just think about that as kind of the intensity of whatever they're
Sure.
dealing with score.
Sure.
And we're hoping that over 14 sessions they're down to a 4, something
Oh,
like
okay.
that, right? That's
Yeah.
that's what we're hoping. Now it may not always go like that, right? But
Mhm.
then we want to know why. So for example, they may trend down, right? And then after 6 session you see they go back up.
Mm.
What happened? Life event, maybe lost someone they
Yeah,
cared
yeah.
about. Of course,
Yeah.
that kind of exacerbates everything.
Yeah.
But being able to understand those things, so the provider is, has the data to prove and also to show that this person is getting it, and also more importantly, use the person getting care,
Yeah.
right? You want to be able to get that report card to see report card.
Something about high
Right,
school.
I know, right? To-
Scared me for a little
right,
bit.
to see that, I know, right? It's like, where's your report card? Oh, anyways, to see that you're actually getting better. Your
Yeah.
symptoms are being decreased, right? If you could only manage 2 hours of sleep when you started, okay, well now I'm at 6. I'm getting close to 8. Those things, they're important. So you see the progress and it validates why you're there, and then
Yeah.
it makes sense, and it also gives you the tools like I can do this.
Mhm.
I can do this. I got support. And then as that support slowly fades away over time, I'm strong enough, I'm powerful, I can do it, right? Because it's there, the evidence is there, the data most importantly is there. But then
Yeah.
also the most value you can give in therapy is to have a provider that focuses on you,
Yeah. That
right?
connection.
And that's one of the things, because this thing is 80% relationship,
Oh yeah.
20% modality,
Yeah.
right? So what we've done, unlike our competitors, is just to take out the distraction,
Mm.
the notes, the Jesus, man,
Yeah.
the
Yeah, yeah,
anxiety
yeah.
and all that stuff. We took it out. Like, focus on this. This
Yeah.
is what you do best. Getting this client from 0 to 1. That's something that we've done, and you see, and when we get the feedback from clients, it's just like I felt heard, I felt understood. You hear things like that because that therapist is there. It's a conversation, right?
Yeah.
It's not like, so let's do this. We got to check this. We got to,
Yeah.
distracting.
Yeah.
Like,
Yeah,
oh
yeah,
my
yeah.
god, So those two things, man. Being able to have a clinician that's focused on getting that person from 0 to 1
Mm-hmm.
and have the data to prove it. It's really how we stand out. Well, in addition to, definitely picking a demographic
Yeah.
that needs it the most.
Okay.
Got it.
Well, my last question was going to be going back to a little bit about data.
Mm-hmm.
Um, how do you guys leverage the data you have? How are you using this data? Where are you getting this data from? Is it stuff that's in house?
Mm-hmm.
And I know there's only so much you can talk about it.
Mm-hmm.
But I guess what are you using to train this data on, basically?
Right. So,
Because you are mentioning a lot of LMs and AIs
yes.
being integrated, so
Right.
keeping it very surface level.
Yeah.
Very surface level.
Yeah.
So they are our own models. So we built them in house.
Nice.
Okay.
So just
Yeah.
we're not baking whatever
Yeah.
back end.
That also builds that connection, that
Yeah.
reliability with the client. So
Exactly.
Sorry, go ahead.
Exactly. One of the things that we do also that we think is important is to educate the client what
Mm.
we're collecting. Right. We take a
Nice.
lot of consent.
Yeah.
We need this data. Do you consent? And this is why we need it. Not just we need
Yeah.
it. This is why we need
Yeah.
it. This helps your clinician do this. Make sure they can focus on you, kind of deal, right? So then, and they have, clients always have the ability to say yes or no. But I feel like when they understand why and how it benefits them, and then of course, our models are proprietary. We built it ourselves. It's all gated. It's the box model. It's
Yeah,
not going
nice.
anywhere.
Yeah.
Of course, we have access to it, and your care provider has access to it. You,
Yeah.
the client has access to some of
Yeah.
it. You can always request your data, whatever you need. And for continuity of care, so for example, if you think about if someone moved from North Carolina to California,
Mm.
and then they had a therapist there, and then that therapist needed to see, hey, I know you've been in therapy. Let's kind of see what was
Yeah.
done. That follows you where you are because it's your health
Yeah,
record
yeah.
and
Yeah,
shit.
100%.
yeah.
So we're able to provide that,
That's
and
nice.
it's funny because every time we send that out,
Mm.
that provider that gets it was like, oh my god,
Yeah.
right? It's like, oh my god, did not
Yeah.
expect this. Thank
Yeah.
you so much. It was good, but we think it's important to really document so then you get a really good picture of what's going on and you can really help
Yeah.
that client.
Okay.
Absolutely.
Thank you. Awesome.
Absolutely. Absolutely. Well, do you have anything you want to kind of touch on before we wrap it up, or?
Oh man, I mean, obviously, if you have if you ever looking for a therapist, right? I think therapy is important. It saved my life.
Yeah.
Big advocate. Whether you have Medicaid, Medicare, or private insurance, for all of the reasons and the biases that I'm part of the company,
Yeah.
you should check us out. At mylavni.com. If you know a dope clinician, a dope therapist that think just tell them about us.
Yeah.
They can check us out.
Yeah.
Yeah.
Thank you so much, Marcus. And yeah, we gotta have you back on sometime soon. So.
Yeah, definitely. Invite me back.
Awesome. Thank you.
All right.
Word.
Thank y'all for tuning in.
Thanks, y'all.
All right.